Dear Milen, dear Mikhail, dear colleagues, I would like to appreciate the organizer of this meeting to make a presentation about our study to treatment patients with acute myeloid leukemia, because it is new one study. And you know that everybody who is in the hall knows that results of treatment acute myeloid leukemia is not satisfied all of you. And from 206 to 2012, we we did a protocol. It was multi-center study where 8 clinics worked in this study. And thank you for all participants in the study. The risk group stratified on 3 groups based on cytogenetic and morphology, because some clinics couldn't do cytogenetic. Standard risk was like BFM 87 protocol, but consolidation therapy was shorter. It was just the first phase without prednisone and vincristine. And maintenance therapy was with epigenetic therapy, valproic and retinoic acid. Intermediate risk group consisted on 4 courses of chemotherapy combined with epigenetic therapy, valproic and retinoic acid. And high risk group got the same 4 courses chemotherapy, and some patients, just 2 patients, got allogeneic stem cell transplantation. So there were 80% of high risk and intermediate risk, and just 2 patients underwent allogeneic bone marrow transplantation. 21% achieved complete remission after induction, and 7% didn't respond, and 1 patient died during induction. And disease-free survival was 54%, event-free survival 50%, and regarding standard risk, regarding risk group, standard disease-free survival was 75%, intermediate 52%, and high risk 47%. Probably it is not bad results, but these results were not satisfied us, and we decided to create a new protocol in 2012, and we add a new epigenetic medicine, demethylating medicine, decitabine, and try to use it in a window regime. The chemotherapy for standard risk group consisted on 4 courses, and intermediate and high risk 5 courses. Just 5 patients got decitabine in window regime. 2 patients underwent bone marrow transplantation, and these patients are still alive without progressive disease. And 1 patient are still alive without bone marrow transplantation. 1 patient relapsed and died during the second line therapy, and 1 patient died during induction. On day 6, after finishing decitabine, just 1 patient developed on decitabine, and he dropped his blood cell count from in bone marrow from 42% to 15%. But this patient was with monosomy 7, and probably he developed his leukemia from myelodysplastic syndrome. And one day, the girl, 5 years, entered to our clinic, and we diagnosed her acute promyelocytic leukemia because she didn't have HLA-DR and CD34, and began treating her like APL. And on day 10, we got cytogenetic, and there was translocation 817. On day 15, we didn't got respond, and there was 74% of blast in BM. And the patient was in bad general condition with severe infection, and we couldn't begin harm. And we decided to do decitabine 20 milligram per meter square from day 16 to day 20. And on the day 21, after the next day after finishing decitabine, we checked bone marrow, and there was just 5% of blast. And this patient got 4 additional courses of chemotherapy, and she is still alive for 32 months without progressive disease. And this patient underwent by bone marrow transplantation. Undergo. And we decided to move decitabine on day 16. And now we have 16 patients. 15 of them had high risk and intermediate risk. All the patients achieved complete remission, and there were no any induction deaths. And disease-free survival was the same like overall survival and event-free survival, and was 76%. And median follow-up 26%. And we decided that demethylating therapy has to be used after induction during aplasia of bone marrow, and epigenetic therapy will allow to reduce chemotherapy in the future. I suppose the 4 courses will be enough, but it is future study, which will be open probably after a few years. And epigenetic therapy doesn't add toxicity to chemotherapy. Thank you for your attention.
Questions? Have time for 1 or 2 questions? No questions? Thank you very much.
No.
1 question.
Mm-hmm.
Pioneer in using the demethylation agent in the AML settings. Did you check the tumor cells for methylation?
For maturation?
Yes.
Maturation?
Yes.
Yes. We saw two patients with Atra syndrome after decitabine. And these patients, the maturation, преметилирование, созревание. Yes, we did, but I cannot say now. This study is continued now, and probably at the end of this, yes, we can present this study, the result of this study. Yes, we do it.